I started to have some symptoms with bleeding in the stool, a little bit of loss of weight, and then I'm a very active person. I started to feel a little bit of blah.
His family practice doctor thought his problems were all related to hemorrhoids, and they actually insisted and went out to find a gastroenterologist because he kept having symptoms. They weren't satisfied with the explanation that they had. It turned out he had rectal cancer.
It's very emotional when you first find out you got cancer, especially when you never expected it. But right away you got to think through your mind, okay, I'm going to beat it.
In Mr. Fern's case, he had rectal cancer, and like shown in this box, this was treated with chemotherapy and radiation to downgrade it. When we do surgery and this area has been radiated, we take out this part that's been radiated, we take normal healthy colon and sew it to the top of that area. Your function is much better than having radiation treatment after surgery.
He said it's going to be a 9-month process, but we're going to take good care of you and we're going to get you fixed up.
In the rectum, the cancer is more complicated to treat. We're bounded by the blood vessels in the pelvis, and so our surgical resection is limited. We often start with what's called neoadjuvant therapy, or a combination of chemotherapy and radiation therapy, to give patients, which downstages the tumor, makes it more curative.
I mow the lawn, I vacuum a little bit, clean the house, I do everything that I used to do, walk the dog. The only time I could not walk the dog was when I came home from surgery because they didn't want me moving too much, and she would pull on me. She's a 70-pound lab.
His prognosis and the surgery has gone very smoothly.
When you have a doctor such as Dr. Simmang who makes you feel like things are going to be all right, it kind of puts you more at ease. He's been around the block, if I could say that. He's had many surgeries, so he knows how to treat people. Very caring gentleman and very good at what he does.